Welcome. I'm your host, Eli Manna. Today with us we have Dr. Cristina Riccio. She's an associate professor of anesthesiology at an academic medical institution in the South with practice focus on difficult airway management. Welcome, Dr. Riccio. It's great to have you here with us today.
Hi, happy to be here.
Thank you. So today we're going to be discussing the use of high-flow nasal cannula in both the OR and PACU. And we'd love to hear your insight on your clinical application, where you use it, and how you feel like your patients are benefiting from this application.
Okay.
So today, if you can then please share with us the main clinical applications where you use high-flow nasal cannula.
Okay, great. So I would say I would break it down into 4 general categories as far as where I use high-flow nasal cannula the most. Primarily, we would use it in the management of difficult airway patients while we attempt to secure an airway. We also use it a lot in ENT surgery or airway surgery, microlaryngoscopy, as the primary means of oxygenating and ventilating throughout the procedure. We can get into that a little bit later. We tend to use it in the NORA environments or non-OR anesthesia environments like our GI suites. And also we would use it in the PACU as well.
That's awesome. So if you don't mind, let's just go ahead and kind of dive a little bit deeper into each one of these areas, starting with the management of difficult airways.
Okay, so historically we have this idea that when we approach an airway, we always pre-oxygenate the patient, and obviously we post-oxygenate the patient. For patients with difficult airway, there's this concept that we peri-oxygenate them, which is where we provide supplemental oxygen during attempts to secure an airway.
Yes.
In patients who are more difficult, whether it be anatomically speaking or physiologically, where they'll desaturate very quickly once we render them apneic, or even if we need to secure an airway awake in someone who has classically a difficult airway or is struggling to breathe, the high-flow nasal oxygen is a great adjunct that can oxygenate them and extend that time period for which you can safely secure an airway.
Sure.
So it takes the stress away to some degree for the providers, because now they, instead of 3 to 10 minutes, if we put someone to sleep before they begin to desaturate, we have a lot longer.
So you feel like it bought you some time just to
Absolutely.
catch your breath and make sure that you move on to step number 2.
Absolutely.
And that's awesome.
It also allows too, if you're securing the airway awake, I know personally, I don't like to sedate patients who I awake intubate. Maybe that's harsh, but for me, if I'm making the decision to intubate someone awake, it is with good reason, and I need their cooperation. However, many people choose to sedate them a little bit as you're attempting to secure their airway awake, and so having such a device can increase the safety at which you feel comfortable giving them enough sedation for them, and for their comfort, knowing that they'll stay oxygenated throughout the process.
Sure. Now, do you feel like you have to deliver a high FiO2 level, or is there a certain level that you stay at during the apneic oxygenation period?
In anesthesia, I would say primarily we use 100% FiO2 for the uses that for the way that we use it.
Okay.
Yeah.
Okay. Yep, that makes sense. That's awesome. So I'd like to move on to a different category of the use of high-flow nasal cannula, and that is in microlaryngoscopy surgery. If you can please expand on that one.
Yes. Okay. So historically speaking, with microlaryngoscopy surgeries, which if people are unaware, it's when we take a patient who needs work done to their trachea or their glottis or just general airway. And the ENT surgeons, we put these patients to sleep, we paralyze them so they do not move. Obviously they're under general anesthesia. They suspend them with a laryngoscope, and then they perform the surgery on their airway. Historically, we would either do this with an intermittent apneic technique where we would intubate them and then we'd extubate them, they'd do the surgery, then we'd intubate them, then we'd breathe them back up, extubate them, they'd continue on, right? Or we would use a jet ventilator. The problem with the jet ventilator is that it has increased risk of barotrauma. It has dry mucous membrane risk because it's colder air, with, from the wall, PSI. So what the high flow allows us to do is to maintain their oxygenation. It maintains a tubeless field. The surgeons love it. They perform the surgery, every 12 to 15 minutes. I would recommend going in, ventilating them to some degree, whether it is with a jet ventilator or with an ET tube. But for a good 12 to 15 minutes, these patients can maintain a SAT of 100% and do very well.
Oh, that's awesome. So you feel like the high-flow nasal cannula actually improved the workflow for you, the surgeon?
Absolutely. And when we first got it in, the surgeons were very suspicious.
Yes.
And once we started using it more often, now they request it. So now we have it in all of our ENT rooms.
Oh, that's great. So how do you feel like, in this particular case in microlaryngoscopy surgery, how do you feel like the high-flow nasal cannula has actually affected patient outcomes?
So I think that the procedures are performed, at least where I work, more quickly because we're not having to stop and ventilate them off as much. They are better oxygenated throughout the course of the procedure. It is more comfortable for them. We just leave it on and wake them up on the nasal cannula.
Okay.
So, and it doesn't get in the way of the surgeon's equipment.
Sure.
So
do you feel like they recover faster post-op since they did not get intubated? Do you feel that that has any ramification on the recovery?
Well, I think so. It's always a little bit tumultuous when you're waking somebody up on a breathing tube after they've just had airway surgery. So a lot of times, they come back breathing quickly because their CO2 has risen. You use less equipment because you wake them up on that, and then we would switch them to a face mask and transport them to PACU. But yeah, I think they do great on it.
Okay, great. So another area that you had mentioned, Dr. Riccio, is the NORA environment. If we can talk a little bit about the use of high flow in the NORA environment.
Yeah, so we have now bought one of these units for every GI suite that we have, and primarily our CRNAs work down in the GI suites, and if they have a patient that they need to deeply sedate, whether it be an EGD or a colonoscopy or both, and this patient has a history of sleep apnea, or they're morbidly obese, or their BMI is greater than 35 potentially, they will reach for a high flow nasal cannula. They feel these patients are better oxygenated, that the small pressure that the high flow generates keeps their airways open. It's less desaturation, less airway maneuvers that they have to do, and they overall feel that these patients do much better on it. It's easy enough for them to grab a fat nasal cannula as opposed to the skinny nasal cannulas that we would normally use. So they're familiar with the product. Patients are comfortable on it because it is humidified. So we use those a lot down there.
Yeah, well, that's great. And then the last area I'd like to explore with you, and you talked about using high flow nasal cannula in a PACU post-op.
Yes.
If we can talk about that a little
Yes. So if we have a patient that we think will struggle, breathing in the recovery room, whether it be because we've caused hypoventilation with the drugs that we use, and they're not quite worn off or reversed, or they have a heavy narcotic on board. If, anatomically, they're going to obstruct. So if somebody is morbidly obese, if they have a high oxygen consumption, like a burn patient that we take care of, a lot of times we can put a high flow on them in the recovery room, and somebody who's sort of on the fence, whether we may potentially have to reintubate them or not, this can oftentimes get them past the point where they need to be reintubated and definitely decrease their work of breathing. Patients do better, for sure.
Okay, well, that's good. Do you feel like nurses, CRNAs, or other clinicians are comfortable with the use of high flow nasal cannula, the setup, the use, and the management of that device?
I think now they are for sure. I think initially when we rolled it out, it's somewhat of it's a setup, but we have our anesthesia techs who set this up for us. They plug it into the wall for us, and most people just need to know how to use a nasal cannula, which is all we do.
That's exactly right.
Absolutely.
Exactly right. Well, Dr. Riccio, thank you so much for being with us today. We're going to wrap up today. Dr. Riccio, any final thoughts for the clinicians, for us, that we can benefit from about the use of high-flow nasal cannula?
I would just say give it a try.
Yeah.
Keep an open mind, give it a try. It can do a lot of things that you would be surprised.
Yeah.
For sure.
Well, thank you very much for being here with us.
Yes.
We appreciate the time and the information.